Hi, my name is Suzanne Craw, and I'm the Director of Pupil Services for Wyndham Public Schools. Today, you are viewing our annual training, the overview of Medicaid and using Medicaid Direct. I want to take a moment for you to recognize the Pupil Services related administrators and or office staff. I want to take a moment to thank Yadira Santiago, our Medicaid coordinator, who helped me put this presentation together today. Should you have any questions regarding Medicaid, she is the best contact, and her contact information is to the left. For those who don't know much about Medicaid, Medicaid is a joint state federal program that offers school districts reimbursement for related services that are included in an IEP and or 504 plan for our Medicaid eligible children. We work and collaborate with the school-based child health Medicaid program here in Connecticut in order to seek reimbursement for these services. With any service and or program, Connecticut does have regulations for which a district can be reimbursed for services. And this requires us to maintain permanent service records for each of these services. We do this by using Medicaid Direct. This provides us a permanent service record in an electronic format. We highlight written evaluations. We have the child's diagnosis, in addition to an IEP and or 504 plan that's agreed upon. And your progress notes are signed electronically within that program. As you can imagine, we must follow federal and state HIPAA privacy practices as a Medicaid provider, which Medicaid Direct, the platform, helps us do. And again, we are subject to federal and state audits as related to our school-based child health claims. So ensuring that we have all of the components within the system are really important when we are asked for any data. Our audits can include a progress log information, so when you provided the services, so the date, the type, the unit, and really important, the description of the service in which you provided during that day. We need to know if they were performed in group and or individual settings, and then that electronic signature by you is essential. It's really important that all of our related service providers maintain their applicable licenses and certifications, and that we maintain financial records associated with all of this. And all these records must be maintained for 6 years. The first step for you to do in order for us to maintain those records is to complete what's called the Medicaid service information. On Medicaid Direct, it's called the related service logs. And so we ask that every month, by the end of the month, you have entered all your related service logs for any student in which you provide direct services based on IEP and or 504. Yadi will send you any missing records after a week after the month ends, so that first week of the next month. And if there's a student on that list that you no longer service, just let Yadi know ASAP. This helps us connect the student to the right provider and or recognize that a student may be discharged from services. With each entry, it is important, as I said earlier, that your session notes document exactly what skill you worked on with the student when you met. And again, why is it so important we keep this all in IEP Direct? We have to keep it in IEP Direct because it maintains an electronic signature. It's an electronic documentation system where we can easily maintain these records for 6 years. And again, just a reminder, I know many of you have been doing this for now a while. Notes are not optional. Every time a student is seen, we do need to have notes as to what skill you worked on. Another important component of Medicaid are the progress reports. These are your MSI Part 2s. These have to be completed monthly. I know, monthly is a lot. The good news about using Medicaid Direct is that you're able, if it's the same service provider reporting, you're able to import your previous data and report. So you're just now hopefully updating a data point within your claim. So the first month is always the hardest to get going. Again, these are required for every student that you see and have provided a direct service. MSI Part 2s, again, are done in the electronic format on Medicaid Direct, and these are retained by the district for those 6 years. Telehealth. Should we return back to remote learning? Telehealth has still been an acceptable practice as long as there's audio and video systems with real-time communication between the students and the practitioner. We do ask that you add these into your telehealth sessions into IEP Direct. Right now, we are not authorizing any telehealth. We are requiring in-person learning. But should the district at any point or a class have to go into long quarantine, this is still an acceptable practice. Random moment time studies. Our participation in the random moment time studies is mandatory for all of us who provide services to Medicaid, and even those of us who are more on the administrative side. So yes, I complete your random minute time studies as well. And yes, I do recognize that sometimes you can get 2 or 3 within a day. These are generated by UMass. It is not something that Windham Public School generates. So if you do have a question, please email them directly at UMass. Our first quarter, which is called quarter 2, begins October 1st through December 31st. Please remember that random moment time studies are a requirement and need to be answered. So for those of you who don't know what a random moment time study is, it's a moment in time where they ask you to tell us what you're doing during a random minute in your day. We need to keep 85% compliance, and I want to thank all of you because we have not fallen below the 85% compliance rate. If we do, we would lose some compensation, but that has not been the case for a number of years for Wyndham. So thank you for all of you who have completed those random moment time studies within the assigned time. So those minutes, they'll ask you 4 brief questions about that minute. They'll ask you what type of activity you were doing, what were you doing, who were you with, and why you were performing this activity. There are drop-down boxes that you can select categories, and most of the time they don't ask for additional information, but every once in a while they may write back to you and ask for additional information. If so, please be sure to answer their questions in a prompt amount of time. When they send you your minute, you'll have 2 school days to answer the moment from the date and time that it was initially issued. They normally come about 3 or 4 minutes before your assigned moment. So for example, if you work Monday through Friday, 7 to 3:30, and you receive your moment on Tuesday at 2:30, then you'll have till Thursday at 2:30 to answer the moment. They send out a lot of notifications, and I know sometimes that can be overwhelming or frustrating to those of you who are answering them. So you'll get a notification at the moment, 4 hours after the moment, 24 hours after the moment. If you don't answer by the 28th hour, it is then CC'd to an identified supervisor. I am one of the identified supervisors who will get this email. I normally then forward that request to your building principal. In case you're out on a medical leave or an extended vacation, personal time, we still have to answer that question, random moment, on your behalf in those cases. And so since Yadi and I are not in the buildings on a day-to-day basis, we may not know that you're out for a period of time. And so therefore, we do notify your building principal to gather more information. And you'll get one last reminder 12 hours prior to the expiration time. Each quarter, they randomly select a 5% sample for validation. And when you complete one of these moments, please submit your full day calendar to Yadi Santiago. Um, this can be done electronically. Many people do this very differently. Some have photocopies of calendars, some just submit their Outlook. It doesn't matter how you send it to her as long as she knows what you did that full day. Parent consent. We are required to have parent consent on file. It's a one-time written consent from parents allowing us to access their child's benefits. This consent has to have four um, uh, components to it. It has to have their personally identifiable information, the purpose of what we're doing, so that we're billing services for Medicaid, and that the parent understands and knows that we can access their benefits. Prior written notice must go to the child's parent before accessing their benefits, and it must be provided to them in their native language. So we do have English and Spanish currently available, and if we need any other languages, please notify the district office. Um, we should always ask for parental consent at your initial 504 or PPT meeting. Um, with these consents, if we ask at our initial PPT or 504 meetings, any evaluations that we do then can be also reimbursable. Do you need a new consent form if a child had consent as a 504 student but now is being evaluated for special education? Yes. Unfortunately, these consent forms cannot transfer between 504 and special ed or special ed and 504. These parental consents should be kept in the child's IEP and or 504. It's the responsibility of the district to ensure that this consent is fully completed, and please be sure to record the date that the initial notification was provided. We must retain a copy of these parental consent forms, and they should be emailed to Yadi Soto as well. We get some common questions regarding parental consents. If a student who was previously part of the district has returned, can the district use the previously signed parental consent? No. If a student has left the district and now is returning, then we must get a new consent form signed. A student has transferred to a different school within the same district. Does the district need a new parental consent form? No. As long as they're just moving from one school to another, we are all set with parental consents. Can the written notification and parental consent form be presented to the parent at the same time? For example, the same mailing or handed out together at the IEP? Yes, we want to make sure that parents receive written notification. So this is their annual rights, and then we can ask them to sign the consent. If a parent has previously declined to provide parental consent, and the school continue to ask for consent, yes. If a parent in 1 year said no, then try again. Explain it. Sometimes if you explain it a different way and listen to their concerns, sometimes they will change their mind and want us to, and will let us use their Medicaid benefits. Evaluations. At one point, there was a statement when evaluations needed to provide services. That sense is no longer the case. If a parent has signed consent for Medicaid and we then conduct an evaluation, we can seek reimbursement for that evaluation. If the student is not found eligible for services, that evaluation may not be billed, but continue to upload your evaluation. But only if the child is found eligible, then we would be able to get reimbursement for your evaluation, even if the child didn't get direct services from you as a provider. As I shared with you, we do get audited annually. They do look for discrepancies, and is really important that we provide services as stated in the IEP and or 504. Common findings of our audits may include things such as missing documentation, so those daily session notes, a missing parental consent form, attendance records, transportation logs, and progress notes. Um, Sometimes there'll be a claim for services on a date where the student's attendant, that the student is marked absent. So we want to make sure that we are completing our part ones, our related service logs, as close to the actual services as possible to avoid these errors. Sometimes there are claims put in for services that aren't authorized in students' IEPs. And sometimes it hasn't been an issue in Wyndham, but in common findings is that services are furnished by non-licensed or otherwise unqualified providers. So here are some self auditing tips. Are services documented through session notes? Are my monthly progress notes completed? Is Medicaid billing current, so completed by the end of the month? Are my RMTS moments sufficiently documented and retained? Are my licensure documents up to date and on file with the district? Is there a current IEP for the student with services clearly identified? Is initial notification documentation for parental consent gained? Is parental consent on file in the child's IEP? And has the annual notification been provided and documented? Please be sure that your related service logs are completed at the end of each month. Notes are not optional and must be completed each time you see a student. Your MSI Part 2s are also due at the end of each month. If you do get one of those random time studies, please submit a full day calendar to Yadi for the day in which you have completed your random moment. Make sure that we have a copy of parental consent on file, and if we do go on quarantine, please be sure to be entering your telehealth and most used videos for students. Behavior modification is also one of the areas in which we can collect additional funds. Our BCBAs will be when they are working with certain students, would be able to collect reimbursement for their services as well. Personal care assistant features, we can describe here, are now Medicaid eligible as well. So if a student requiring these services, consider adding this under the related services. Behavioral assessments, as you know, can also be Medicaid eligible for our students on the autism spectrum. And Yadi, after you complete your training, will forward you all of these documents and resources in an email. If you need any help finding these documents, please don't hesitate to reach out to Yadi. We wish you all the best for a successful school year. Thank you.